UnityPoint Health St. Luke's Hospital takes you inside the heart for a MitraClip procedure in Cedar Rapids, Iowa. Our patient is Gwen Leland. She's an 84-year-old who lives in Anamosa. Leland says she suddenly started having difficulty catching her breath last fall, which made it hard for her to walk and move around.
Shortness of breath was the main thing. And then I can't walk from here to there because I get so out of breath. And that's when I went to the doctor and found out about the AFib, and then she ordered the electrocardiogram, and then they found out about the mitral valve leakage.
From symptoms standpoint, so this would make patients feel like fatigued or tired or not able to exercise or like decrease their exercise tolerance. And then they might feel short of breath with activity. They might start retaining fluids, like have swelling in their legs or waking up short of breath from fluids in the lungs. And the other thing is, if this keeps progressing, the heart muscle is going to get weaker and weaker, and then this does affect their survival.
Implant's going.
It was recommended Leland undergo a minimally invasive procedure called MitraClip. St. Luke's is the only Cedar Rapids hospital that performs this advanced heart procedure.
They're going to use the clip to clip two of the flaps on the mitral valve, and that should allow the blood to flow the way it's supposed to.
MitraClip is a minimally invasive procedure that's done with a catheter from the groin through a vein, a femoral vein, in order to repair a regurgitant or leaky mitral valve.
Leland's MitraClip will take place in a heart procedure room at St. Luke's, which is located in the Nassif Heart and Vascular Center. St. Luke's Heart Care Program is Cedar Rapids' largest and most comprehensive heart care program.
It is a procedure room where we do our heart cath, we use stents, balloons and stents, the regular day-to-day heart cath we do. It is a team approach, and so there's the cardiac anesthesiologist. This procedure is done under general anesthesia because it's also, the patient will have a probe down their throat to use, it's called TE, to guide the procedure. So most of this procedure actually is done under guidance with the transesophageal echo, with live images. Most of those also actually are 3D live imaging. So that's why we have in the room a very advanced specialized imaging cardiologist. And then there's the interventional cardiologist who does the catheter procedure, and so in coordination, like live coordination with the imaging cardiologist. There are two types of patients who would or might need the MitraClip procedure. First, there are the patients who have what we call primary mitral regurgitation, or a primary problem with the valve itself. So one or both leaflets will have some kind of degenerative problem where they're not closing down that they're supposed to, and then the valve starts leaking. The other group of patients is the ones who have a weak heart muscle or enlarged heart on the left side, left heart failure, and the enlarged heart will pull in the mitral valve leaflets and make them not close all the way, and the valve leaks, and this is the second group of patients who might need such a procedure. We have different medications, but this is not a cure. This is just trying to minimize the symptoms and prevent progression maybe. So unfortunately, there are two ways. I mean, there are some patients who need open heart surgery to fix that, and then there's the minimally invasive way, which is the MitraClip. We have a conference once, we call it case conference, once a week, where we discuss such patients and the management, and is it time to fix the valve or not, or if we decide it's time to fix it, what is the best approach? Is it minimally invasive, the MitraClip, or is it, does the patient know it should be better candidate for open heart surgery? The imaging cardiologist will be helping us first navigate the catheter to the left side of the heart. So we go through a vein in the groin, we go to the right side of the heart, our right atrium, and then we cross the septum. We do what's called transseptal puncture, and we go to the left side of the heart. So they help us with the navigating to that spot. And then they help us navigate the clip itself to position it above the valve, and also in the right spot where we want to position this clip. So for navigation, and then the orientation of the clip, and then also to grasp. So the clip has two arms to grasp both leaflets, each for one leaflet, and then the imaging specialist will be telling us that's a good grasp, that we got enough tissue in there, and then we're comfortable with the position. It's a good position. We achieved good reduction in the mitral regurgitation, and if everything is achieved, then we go ahead and release the valve for final deployment. So the clip, I mean. So you can see it's like every step, it's a coordination between the interventional cardiologist and the imaging cardiologist. Most of the time, patients are just extubated in the same room, procedure room. All the lines are out. They go to a recovery room. They recover for a couple hours, and then they go to a regular floor room where we usually like them to walk in the same day, later in the day, to ambulate. And most of the patients go home the second day. And they go home, they should be able to do activity. We restrict them from strenuous activity for a month usually. Like no heavy weight lifting and no like extreme activity, but they can usually, most of them, do whatever they like to do. Actually, it's one of the, it's impressive how very frequently the patients would wake up from anesthesia or sedation, and then they would say, I feel like there's something different. Like they feel like their breathing is easier. So it's very common that patients notice a difference, like either right away or like second day.
UnityPoint Health St. Luke's Hospital is Cedar Rapids Heart Hospital. As the area's leader in open heart surgery since 1978, we invite you to learn more about our program and St. Luke's Heart Care Services today.